was once very pro-abortion, but I slowly, by the grace of God, made the transition to pro-life. When I entered medical school, I believed that abortion was a woman's right. I thought no woman should have to have a baby that she didn't want. We learned to do first trimester suction abortions when we were in training, but I was so pro-abortion that I went above and beyond and did a preceptorship with one of the attendings to learn how to do second trimester D&E or dismemberment abortions. To me, a human embryo or fetus was no different than a chick embryo, the ones that I dissected in college. And I can't quite understand how I could do this, but to me, the little feet, seeing the little feet and the arms and the body parts was just fascinating. I didn't see that as a little human being. I just saw it as an embryo. And I actually enjoyed sending the tissue to pathology and then looking at the slides to see what everything looked like on a microscopic level. I was so pro-abortion that I got a job moonlighting in an abortion clinic instead of working in an emergency room, because I could make more money at the abortion clinic. And I also felt that I was being very pro-woman. I was taking care of this problem that women had and saw myself as sort of women's savior. And so I was very happy taking care of women, doing their abortions, both during my residency program and as I was moonlighting. I even went so far as to continue doing abortions while I was pregnant, and I saw no conflict in that. Their babies were unwanted, mine was wanted, so I was continuing my pregnancy. I was ending theirs. I didn't see any problem with that. The problem came after I delivered. I think I must have made that baby-fetus connection. Suddenly I realized that wasn't just a blob of tissue. It wasn't just some subhuman. This was actually a baby that became a child and had its own personality. After I went back to the clinic, I realized I had to make a choice. Was I going to continue to do abortions and kill these little human beings or not? And what I realized was that just being unwanted was no longer enough justification for me to kill these babies. The sad thing was that I still believed that abortion was a woman's right. I still referred for abortion. And that continued even after I became a Christian. The thing that began to change my mind was seeing children grow up in our church whose mothers had almost aborted them or strongly considered aborting them and didn't. And as I saw those children, as I saw those faces, these wonderful, lovely human beings who wouldn't be here had their mothers made another choice. And I began to realize again that these are people. The other thing was that I always believed that having an unwanted pregnancy was the worst thing that could happen to a woman. Well, that wasn't the case in my practice. That's not what I saw. What I saw was women who felt that they just had to have an abortion, go ahead, have their abortion, and then come back with psychological problems and physical problems. I had one woman who told me that she was an educated woman, professional. When she got pregnant, her knee-jerk reaction was to have an abortion. When I saw her, she came in because she was having some issues with bleeding. And she told me that the realization that she had killed her child was so much worse than the realization that she had been pregnant. And she deeply regretted having her abortion and was seeing a psychiatrist to try to deal with the psychological aftermath. I had another woman who came to see me for continued bleeding and pain. She had had an abortion at 20 weeks. The baby was born alive. They told her to sit on the toilet and push, and the baby was delivered into the toilet, and she watched him drown. I don't know that woman will ever get over the psychological consequences of her abortion. Still, I felt abortion was a woman's right. I still referred people for abortion. One of the things that really surprised me after I got into practice and was something that chipped away at my pro-abortion armor was the fact that I believed that if a young girl had a baby she didn't want, that it would ruin her life. That's not what I saw in practice. What I saw was these really young girls deciding to keep their babies and their families and friends rallying around them and them being very successful. They didn't have to quit school. There was help available even for those that didn't have their own support. But there was help available, and these girls did well. The thing that finally changed my mind was reading an article that compared abortion to the Holocaust. At that point, I realized how they could do it. They did not see the Jews as human beings, just as I did not see the fetus as a human being. And that was the point where I became pro-life. When we look at this from a scientific standpoint, it's interesting. Science is on the side of life. When that egg and sperm meet, a unique human being is created. A unique human being is formed. Prove that. That's scientific fact. And yet, somehow we have allowed ourselves to believe or allowed ourselves to be taught that although this is a human being, that we somehow have the right to kill it. And that's wrong. We all have choices to make. And I initially made the wrong choice in deciding to kill those helpless human beings. And I'm thankful that I finally made the right choice and made the choice to choose life. Saddens me is that I was so concerned about my patient, and I've always been concerned about my patients. I did everything in my power to make abortion as painless as possible for them. Now, that wasn't completely possible. It's a very painful procedure. It causes a lot of cramping and a lot of pain. But I learned how to do the best block. I'd have someone there to comfort them during the procedure. I tried to make it as good an experience as I could for them. The sad thing is that as I was dismembering these babies actually the same size as those at one point I was trying to save in the neonatal intensive care unit, I didn't even consider what pain and agony they might be experiencing as I tore those little bodies limb from limb. I think if we could see inside the womb, I think if we were like the cows that they put plastic somehow over their stomachs so they could see how how the stomach worked in a cow, how it digested things. I think if we had a piece of plastic over our abdomens when we were pregnant so that we could see inside, we would not even consider abortion, because we would see that little human being in there, and we would know what we were doing. It's interesting that 85% of OBGYNs do not do abortions. And those that do generally don't do them for very long. Because although the public's been told it's just a blob of tissue, it's not important, the abortionist has to count the body parts. You can only count body parts for so long before it sinks in. If you have any sense of right and wrong or morality, you cannot continue to do abortions and continue to look at those torn bodies and not begin to feel something. I met an abortion survivor who told me that her D&C with suction procedure couldn't be completed because she had a large head. And so the doctor gave up, told her mother she would probably miscarry, because I knew exactly how to handle that. And I simply would have used a larger clamp to crush her head and dismember her body and complete the procedure. And as a matter of fact, I had done that with a baby of the same gestational age that I initially thought was 12 weeks gestation, and it turned out she was 16. And although we didn't do second trimester abortions at the clinic where I was moonlighting, because of my additional training, wasn't long after I'd graduated from college, and I had a job at a parochial school. I'd been accepted to medical school, and I was trying to raise the money for my first year's tuition. I had a car. I felt independent, and I was driving along on top of the world, and I can't remember the question, but I remember the answer. I said to myself, well, I can't give my life to Christ now. I want to have some fun first. I looked at myself as sort of a goody two-shoes, having grown up in a preacher's family. What would have happened had I not made that choice? I made the choice to go my own way and not God's way. And I spiraled downwards from there, because it was shortly thereafter that I went to Florida on a spring break. I met my future husband, had sex, got pregnant almost immediately, and decided that the most logical thing was for me to get an abortion, because I was afraid I wouldn't be able to go to medical school. I thought everybody would think I was terrible. I thought that if I got married because I was pregnant, that our marriage wouldn't last. And it's interesting because none of those things proved true later. My marriage still ended in divorce. Those who really loved me and were my friends would have supported me. And I found when I got to medical school that there were a whole slew of women there who had had their children first and then went to medical school. And so all of the reasons that I had for choosing abortion weren't even really valid. But I think that affected my thinking, and perhaps was why I was so pro-abortion during my residency program. I think that colored my view of things, and I wanted to help other women out the way I had been helped out. The media has been very successful in helping us feel compassion for women who have unintended pregnancies. The woman who has an unintended pregnancy only has to be pregnant for a short period of time, a matter of months, especially in many cases when women haven't discovered the pregnancy until late. And yet this other human being who is involved may be deprived of their entire lifetime, and we forget that. And somehow we need to have as much compassion for the person who may never see the light of day, as we do for the woman who is inconvenienced by this pregnancy, does have choices. She can choose to give her child the chance for life by allowing someone else to adopt the child. She can choose to keep the child. She doesn't have to choose abortion. What we have to remember is that this is another human being who has just as much right to live as she does. By being so concerned about a woman's right to her reproductive freedom and her right to convenience, her right to not have to go through a pregnancy that she doesn't want, we have completely negated the first right, a right given to us by the Constitution, our right to life. We have completely overlooked that right when it comes to a baby in the womb.